They say music is healing, the Orlando Philharmonic, setting the stage for a moment of calm. Amid the COVID-19 pandemic, voluntarily performing at Seminole County's vaccine site as folks navigate the process. The Oviedo Mall is the main vaccine site run by Seminole Emergency Management and the Florida Department of Health in Seminole, one of the state's 67 health departments.
County health officials say the bulk of the state's doses have gone to one of these 5 entities: the Department of Health, hospitals, Publix, CVS and Walgreens, and nonprofits and churches. Who decides, or how is it decided, how many Seminole gets, Volusia gets,
Vaccine?
Osceola? Yeah, exactly.
That's solely at the office of the governor.
Okay. And have you heard anything about how they decide how many you get?
We are not privy to the algorithm used to dispense vaccine to the community.
Alan Harris is Seminole County's emergency manager. Once the counties receive their share, he says they decide how to distribute them. For example, this is Seminole's plan: one fixed vaccine site, a mobile site, going to homebound people, and a team vaccinating healthcare workers.
How you operate a vaccine clinic in Miami-Dade is going to be vastly different than how you do in Liberty County, which is the population of a high school here in Seminole County.
Meanwhile, in Volusia County, they have several fixed vaccine sites.
Volusia County's health department has been vaccinating people at 3 different sites, including here at the Volusia County Fairgrounds, as well as Deltona and the Daytona Stadium.
Health spokeswoman Holly Smith
They pull up, the nurse walks over.
says their sites have been running smoothly with the supply they've received, 18,700 doses, which she knows because the county tracks all the doses in this database, Florida Shots.
All providers, whether it's Publix or Walmart or Sam's Club or the Department of Health or your local doctor, when they get those vaccines, they're required to record that in a system called Florida Shots, and that will tell people where every single dose went.
The state then uses that information to post these daily vaccine reports showing how many doses each county has received. But the state has not answered our questions about where exactly each dose has gone and how they decide who gets how many. According to the state's latest report, Central Florida residents have received nearly 20% of all doses administered. And according to the U.S. Census Bureau, about 20% of the state's total population and senior population live in these counties. From counties to hospitals, the state also released reports on which hospitals it sent vaccines to, but not how many. In our area, Orlando Health tells us the state sent them nearly 75,000 doses, Advent Health over 40,000. Next, private companies like CVS, Walgreens, and CDR McGuire tell us this is how many doses they've gotten to vaccinate folks in skilled nursing and assisted living facilities. And lastly, health experts say doses have gone to Publix, nonprofits, and churches. We've asked the state how many, but they won't say.
Right now, people are flying blind. They don't know where to go, who to call.
Dr. Aftab Khan treats coronavirus patients in Central Florida. He says the state should make it clear how they're deciding who gets how many doses.
Minorities are the ones who suffered the most from this pandemic. Unless we address those concerns and distrust towards the vaccination, we will not get 70 to 85% people in this country to be vaccinated, which is important for herd immunity.
Now, for over a week, I've reached out to the state health department and emergency management division, but they have not replied. Now, for more detailed information from the counties and companies that did reply, check out WESH.com. Live in Orlando, Marlene Martinez, WESH 2 News.